all this increased usage. We're seeing, video calling and lives like this are double the normal amount of usage or more. Some types of calling, group video chats, I think we're seeing are up like 5x or something ridiculous like that. Because in times like this, especially when people can't be together in person, they really want to use these services to be able to stay to be able to stay connected. And I don't think we're the only ones who are seeing that. My understanding is that a lot of the internet infrastructure is coming under a lot of pressure right now, especially with a lot of people staying home, sharing videos, watching videos. So this is something that we're going to need to really work on over the next few weeks, is just making sure that everything stays efficient, and that basically that the networks can stay running smoothly while everyone is relying on them to stay connected to the people who they care about. All right. Well, in addition to this being a big health issue, we're also very focused on this as an economic issue. Small businesses, I think, are going to be under a lot of stress as a lot of people around the world don't want to go out to restaurants and different places like that. And we really want to do what we can to help the recovery there. So we announced yesterday a program where it's a $100 million grants program for small businesses, where it's about 30,000 businesses around the world in cities where Facebook employees live and work. It can apply for grants, and small businesses are really important, not just for people's jobs. but they're critical as parts of the community. They often hold local communities together. They're places where we go to hang out, get together with friends when we can go out and do that. And it's just really important for the stability of our society and economy that they can continue doing well and can get through this and recover quickly. So we're working to do what we can on that. There were a few other things that I want to go through, just in terms of how we're making sure that our workforce stays safe. But I also want to see if there's anyone on this thread who has any questions, and I'm happy to take a few questions before wrapping up here. On the workforce side, the big thing that we did before, even before the governments gave the orders that they wanted people to slow down people coming into work, to slow the spread of the virus, and we recommended globally that pretty much all of our employees, except for some critical staff who run the data centers and are involved in safety and security and in some key things like that, we recommended that all those folks work from home. And it's really important. I want to give a plug for this, which is that especially across the U.S., across all places in Western Europe, I think the official guidance from governments at this point is that you should stay home. And basically, this is really important to stop and to slow the spread of the coronavirus, because the bad outcome here for public health is if a lot of people get this at once, and the hospital system gets overrun, and that ends up leading to much worse health outcomes, both for people who are in there who are sick with the coronavirus, but also people who are in for other sicknesses or normal things that they would have gone to the hospital for. So it's we really need to make sure that we're doing everything that we can to slow the spread and reduce the peak of the hospital load, and that will help make sure that that basically the health outcomes remain as good as possible for everyone across the world. I'm reading some of the comments and seeing if there are any questions here. Mostly emojis. All right, can you tell us a bit more about the the small business support plan. As a small business, we heavily use Facebook and Instagram, so we're happy to hear that there may be something for small businesses like us. Yeah, so we announced this plan. It's a $100 million program to give grants to small businesses around the world, and especially in cities that our employees live and work. And the idea is just to fund help with the recovery, right? So part of it is grants that you can use for whatever is useful for your business. Part of it is tools in order to be able to use the internet and our tools to be able to attract and reach new customers and speak to the customers that you already have to make sure that that you can keep on growing, even if there's an economic downturn. And so I posted about this yesterday on Facebook, and the link is in the post that I put there. But if you want to apply for the program, we're going to basically be funding 30,000 small businesses in a number of cities around the world. So it sounds like if you're running a small business, then you're the type of folks who we have in mind for this. And we want to make sure that we can do our part to support small businesses and growing and kind of staying this base of support for the economy in our local communities. All right, what else is going on? How do we participate? All right, Joshua, what constitutes a small business? I don't, off the top of my head, know the exact criteria, but it'll be on that website with the link that I talked about before on my Facebook page. I mean, I think if I think unless you're running like a large enterprise, I mean, you're probably in the range that we're talking about from this. I mean, we're not just talking about little shops that only have a couple of people. I mean, you can have a business that might have 50 employees or 100 employees and still be a small business. So check out that link and apply if you think it's something that could be useful for you. All right, let's see. What is the latest research on COVID? So I guess one thing that I didn't talk about before, I was mostly talking about the Facebook response, but we're working on this a bunch through our family's philanthropy of the Chan Zuckerberg Initiative too, that I do with my wife Priscilla, and so we have somewhat of a lens into the health system and science there, because a lot of the Chan Zuckerberg Initiative's work is on science, with this emphasis on, it's a long-term project, but the goal is to help scientists cure, prevent, or be able to just manage all diseases by the end of the century. It's ambitious, but I do think that science is making a lot of progress, and it is possible over the next many decades. So what we see here, we're doing a number of things. One is we're working a lot on just increasing the testing capacity for coronavirus, especially here in the Bay Area around our home. We're 4xing the capacity of the local hospital at UCSF. It's a great hospital and university, and they're doing great work to make sure that they can increase the capacity of testing, and that's obviously an important part of the response here. Another part of what we do is, we have this project that we call the Human Cell Atlas. And the idea is, it's kind of like, when you study chemistry, like the first thing that you learn is the periodic table of elements. That's kind of the roadmap of all the different pieces and the different types of elements and how the different states they can be in, how they interact with each other. And we don't have anything like that in biology yet, right? We don't have a periodic table of elements for all the different types of cells in your body and the different states they can be in. So that's what this project, the Human Cell Atlas, is trying to do. And part of that is is there's a subpart, the lung atlas, which basically a bunch of scientists who we work with are putting together this inventory of all the different cell types in the lung and the different states that they can be in. And we make sure that all this research is published openly, right? So that way any scientist can read it. It's published on this preprint program server called bioRxiv. So that way, while it's getting reviewed by the scientific community, you can just put it out there and people can check it out. And a bunch of researchers have looked at basically some of this data on the different cell types in the lung and how different other drugs have reacted with them in the past, and now have a bunch of different ideas for possible therapeutics that could help reduce some of the symptoms of coronavirus. And if that's possible, then a lot of the long-term damage or fatality that we're seeing comes from reaction in the lungs. And if there's a way to reduce the symptoms there, and the severity of that would just be a very big deal. Now, none of this is going to be ready like today, or even in the coming weeks or months. But if it's possible to take existing compounds that have been approved for helping to fight other types of diseases, so they've already been certified as safe for people to take, and if we find that they can be effective here to address coronavirus, then that could be a pretty big step forward and something that we're pretty excited about